Hello everyone, my name is Dia Gurung and today I'll be talking about how CT scan and MRI are different from each other. So first let's begin with a research paper based understanding. So this is a research paper for CT versus MRI in stroke patients undergoing EVT. And I'll be presenting a research that compares CT and MRI for selecting acute stroke patients who are undergoing endovascular thrombectomy or EVT within 6 hours of symptom onset. Researchers reviewed studies from Medline and Ovitemdes up to November 2024. They looked at outcomes and workflow metrics in patients who were selected for EVT using either CT or MRI. And the main focus was on functional independence at 90 days and workflow times, such as door to imaging and door to treatment intervals. A total of 9 studies involving more than 11,000 patients were analyzed. About 3,000 had MRI and over 8,000 had CT. The findings showed that MRI and CT had similar 90-day functional outcomes, meaning both imaging methods were equally effective in helping patients recover. Interestingly, MRI patients had a slightly lower mortality rate compared to those selected with CT. However, MRI took a little longer, roughly 10 to 11 minutes, more for imaging and treatment initiation. Despite this small delays, the overall total arterial rupture time was similar in both groups, meaning treatment was not significantly delayed with MRI. So the study suggests that MRI before EVT is a practical and feasible alternative to CT. It offers comparable clinical outcomes with major workflow delays. The authors also note that more randomized trials are needed to confirm these results before they can be applied widely. So now I'll be talking about the book chapter. So this is the book chapter I've taken from the Lucas County Health Center. Let's find out the difference between an MRI and a CT scan. As you can see in here, an MRI scan is designed to look at soft tissues like tendons, ligaments, the spinal cord, and the brain. It uses strong magnetic fields, not radiation. However, the bony structures appear less detailed than in a CT scan. Since the MRI machine is large tube, some patients may feel claustrophobic or anxious. The scan takes about 45 minutes to 1 hour, and the machine makes loud noises. So you'll be given earplugs or headphones. Also, people with metal implants usually cannot undergo MRI due to magnetic effects. And now about the CT scan. A CT scan is better for injuries, trauma, staging cancer, and examining blood vessels. It gives clearer images of bones and works using low doses of radiation. CT machines are donut shaped, more open, and most people feel comfortable inside. They take just 10 to 15 minutes, make soft vibrating sounds, and metal implants are not a problem. In summary, MRI is best for soft tissues details, while CT is faster and better for bones emergencies. Both are powerful tools just used for different medical needs. And now let's have a look at a study case. I've taken a video from YouTube.
I think it can be confusing. We get a lot of questions every day. CT is, in layman's terms, an X-ray machine hooked up to a computer. When we are scanning the patient, we lay the patient flat on the table. CT uses a thin, pencil-thin beam to take cross-sectional images of the patient's body. The beam rotates around the patient's body, and we slice the patient's body like a loaf of bread. That's how CT scans. It's utilizing radiation to take the images. It needs to be quick because in this day and age, of course, the biggest concern that we have being in imaging and radiology is to keep the doses as low and as safe as possible, but still give us that good quality diagnostic study. MRI stands for magnetic resonance imaging. MRI images the water molecules in the body, and it does that with a very strong magnetic field, which is the big cylindrical tube. That's the magnetic field in there. So if the patient were to lay down on the table right now, we would place their shoulder into that coil, and between the radio frequency, the strong magnetic field, and the coil, which acts as an antenna, we are going to produce images of the soft tissue and the bone with MRI. I think that's one of the things that patients get the most confused on. You know, a typical MRI is going to take at least 30 minutes. A CT scan is typically 5 minutes. CT is going to be excellent for the organs in the body. It's going to be excellent for bony detail. MRI, on the other hand, uses no radiation at all. It's using a strong magnetic field and radio frequency. Its specialty is soft tissue. I would definitely send them to CDI. I would send them there because I know what kind of quality scan they're going to get, and the radiologist reading it on the other end is very good at what they do, and so I just don't know how you could get any better.
So this video talks about the difference between MRI and CT scan. And now let's have a look at lab video I've taken in our radiology lab. Since there is no CT or MRI in our lab, so I've just talked about it.
Exploring the differences between CT and MRI. A CT scan uses X-rays to take multiple cross-section images of the body. It's fast, especially useful in emergency like trauma. Because it uses ionizing radiation, there's always a trade-off: speed and raw diagnostic ability versus radiation exposure. One thing to note: the radiation dose can vary a lot depending on the machine. For example, a study comparing different multi-detector CT scanners for routine brain imaging found more advanced scanners like 160 size CT scanners produce acceptable image quality with much lower radiation doses. So now, what is an MRI scan? MRI uses a strong magnetic field and radio waves. Non-ionizing radiation is involved. MRI excels at showing soft tissues, brain, muscles, ligaments, cartilage, details often not seen in CT. For example, in soft tissues, tumors of the extremities, MRI was shown to be significantly better than CT at differentiating tumor versus muscle or a tumor versus visual using certain pulse sequence like T2-weighted or inversion.
So this is my lab video, and I hope with this instructional video, it has made clear the difference between the CT scan and MRI. Thank you.